Good afternoon. My name's Amanda,
I'm Alondra.
and today we're going to talk to you about the effectiveness of ginger supplementation in alleviating hyperemesis gravidarum, a systematic review of meta-analysis. So first off, what is hyperemesis gravidarum? So this is going to be more than just your typical morning sickness that women experience during their first few weeks of pregnancy. With this condition, women experience more severe nausea and vomiting and typically peaks around the second trimester, but sometimes this condition can last for the entire pregnancy. Some clinical signs and symptoms are persistent vomiting, nausea, inability to keep food or liquids down, weight loss, and dehydration. It is crucial that this condition be treated as soon as possible because not only can it lead to maternal malnutrition and may require hospitalization, but it can also result in low birth weight of the fetus. The available treatment options are things like antiemetics and ginger, but ginger has gained some popularity due to it being a more natural product and safe to consume. So what is ginger? Ginger is or otherwise known as Zingiber officinale. It is a plant that is native to Southeast Asia that has been used for centuries for both the spice and medicine. The part that we use is called the rhizome, which is underground stem, which contains active ingredients like gingerols and shogols, and these compounds give ginger the anti-nausea and anti-inflammatory properties. This is why it has been studied as a treatment for pregnancy-related nausea. And it's important because ginger is considered a non-pharmacological antiemetic therapy, meaning that it can help reduce nausea and vomiting without being a traditional prescription medication. This is what draws the attention to those who prefer a more natural treatment option. Ginger can also serve as an herbal alternative, meaning that it is safe and may be a great option before moving to stronger antiemetics. Another key advantage is that ginger is accessible and versatile. It can be consumed in several forms, including fresh ginger root, powdered ginger, teas, capsules, you name it. This allows patients to choose a form that is easiest for them to tolerate. This is why researchers have become interested in evaluating whether ginger can be an effective treatment, especially for hyperemesis gravidarum. This topic is important because nausea and vomiting is extremely common during pregnancy, and it can affect approximately 50 to 80% of pregnant women. While symptoms are often mild, they can significantly impact daily functioning, nutrition, hydration, sleep, and in general overall quality of life. Because these conditions is so common, finding a safe and effective treatment option is clinically important. Ginger has gained attention because studies suggest it may reduce the frequency and severity of nausea. This makes it a potentially useful option for patients seeking symptom relief. Another reason this topic matters is that many pregnant women are cautious about taking prescription medications, and some antiemetic medications could have potential harmful effects. And patients often prefer to minimize medication during this delicate time. From a pharmacological standpoint, ginger is also interesting because it contains active compounds such as gingerols and shogols, as I mentioned before, and these compounds are believed to contribute to its therapeutic effects. And overall, this topic is important because it combines a very common pregnancy symptom with the need for safe, accessible, and evidence-based treatment options. Moving forward to our methods, in this study, the researchers used what is called a meta-analysis. And now a meta-analysis is a statistical method that allows a combination of multiple studies to be analyzed to produce one overall conclusion. In this study, the researchers pulled from a variety of different platforms such as PubMed, Cochrane, ResearchGate, and a couple of others. In Figure 1, this is a PRISMA flowchart. This outlines the screening process, and the researchers initially identified 32 studies from the different databases that I just mentioned. And they removed six duplicated studies, and two that were automatically marked as ineligible. This step helped with eliminating redundant or irrelevant studies and left them with only 24 studies that were screened based on their titles and abstracts. Out of those 24, three were then excluded because they were not accessible. Next, the 21 reports were sought for a full review, but out of those 21, eight were could not be retrieved and thus eliminated. This resulted in 13 studies that were then fully assessed for eligibility. Out of those 13, three were excluded due to inconsistent data. And finally, we were finally left with 10 studies that were included in the final analysis and that will be used in the meta-analysis to determine ginger's effectiveness. This process ensures that only high quality and relevant studies are included, which strengthens the reliability of the study's conclusion. The next step in this process was to now evaluate the quality and reliability of each of those 10 studies, and in doing so, they use what is called a Cochrane risk of bias tool. This tool helps the researchers in determining if the results from each study can be trusted by identifying any potential source of bias. There were two independent reviewers, and they both used the same template looking at study characteristics, intervention details, comparison groups, and outcome measures. And for the measurements, they did look at p-values, confidence levels, and the effect size. And during the data analysis, the researchers examined how different forms, dosage, and treatment durations of ginger could potentially influence the results. This is because ginger was administered in multiple forms, which included capsules, biscuits, and powder. The researchers had to compare whether the method of delivery affected its antiemetic effectiveness, and this is important because the absorption and patient tolerance may differ depending on the type of formulation. So to ensure reliable results, the researchers used specific inclusion and exclusion criteria. On the left, for inclusions, they focused on clinical trials, randomized controlled and placebo-controlled studies involving ginger for pregnancy-related nausea. And on the right, you can see that the inclusion criteria were studies that had insufficient data, review articles, and because they only summarized data, they were excluded. And studies with poor design and or had inconsistent results, and of course, any study with high risk of bias were also excluded, since bias can distort the true effectiveness of a treatment.
So now going into results, figure 2 summarizes the risk of bias in 10 studies included in this review of ginger for hyperemesis gravidarum. The authors used the Cochrane risk of bias tool to evaluate how strong and trustworthy these studies were. This tool looks at several possible sources of bias, including selectional bias, performance bias, detection bias, and other study weaknesses. In this figure, the green means a low risk of bias, while the red means high risk of bias, and the white means unclear risk. Each bar shows how many of the included studies fell into each category. One important pattern is that the blinding of participants and personnel was mostly low risk, which suggests that many of these studies were reasonably strong in that area. Overall, this figure shows that these studies have some clear strengths, but not all of them were as equally strong in every category. Because of that, the results of the paper are still useful and fairly trustworthy, but these should be interpreted with some caution. Here in Table 1, it gives an overview of how the 10 studies in this review were designed when it comes to hyperemesis gravidarum symptoms. One important thing that this table shows that the paper did is that it did not just rely on one study, but instead of many types of experiments. Instead, it includes a variety of study designs, such as comparative studies, clinical trials, and randomized double-blind trials, as well as others. This strengthens the review because it brings together evidence from several types of research. This table also shows us sample sizes that vary. We have from as few as 28 participants to as many as 291 in different studies. This matters because larger studies usually provide a more reliable estimate than smaller ones. Another thing we can see here is that these studies were carried out in several different countries, including India, Australia, Thailand, and Iran. This suggests that these findings were not limited to one hospital or one population. It also is made clear that ginger was given in several different forms, including capsules, powders, extracts, juice, and biscuits. This shows that ginger can be used in multiple practical ways. Finally, comparison groups are also varied. In some studies, ginger was compared to a placebo, while in others, it was compared to vitamin B6 or other drugs. This is important because if ginger performs better than the placebo, this suggests that it has a real treatment effect. And if it performs similarly to standard treatments like vitamin B6, then it suggests that it may be a possible alternative support treatment for pregnancy-related nausea. Here in Table 3, it talks about the study's demographics. Most participants were pregnant women who were between the ages of 18 and 40, which fits this paper's focus on pregnant-related nausea and vomiting. These study years range from 1998 to 2015, showing that ginger has been evaluated for many years rather than a short time frame. This study was a bit contradicting, though, since there were studies here that followed non-pregnant women as well. So here, Table 2 gives more detailed information about what happened in each individual study. It includes intervention details, which tells us the dose and form ginger was used. It includes control details, which shows what ginger was compared against. It has outcome measures, which explain what researchers were looking at, such as nausea severity or vomiting episodes. And it has statistical findings, which shows if these results were significant. One important point from this table is that the studies did not use all of the same ginger treatments. Instead, they used ranges of doses and forms. including 1 gram per day, 250 milligrams 4 times a day, and 650 milligrams 3 times a day. This suggests that the evidence comes from multiple forms of ginger rather than one standardized preparation. Another key finding is that several studies showed ginger performs similarly to standardized treatments for pregnancy-related nausea. For example, two authors both found that ginger was about as effective as vitamin B6, and another found that to be even more effective than vitamin B6, while another author found that ginger was just as effective as a drug named dimethyl hydrate, but it even caused fewer symptoms than that drug. Together, these results suggest that ginger may be a good alternative to standard treatment and may sometimes even work better. Some statistical findings here were also especially strong. Several studies reported that a statistical significance reduction in nausea and vomiting. One study found a very strong result was a p-value below 0.001, while others showed significant improvements with p-values being as low as 0.024 and 0.01. Overall, Table 2 supports that ginger has a real effect in reducing nausea symptoms across multiple studies. Here in figure theory, it shows a funnel plot, which the authors use to check publication bias. Each dot is one study. The x-axis shows how strong the study results was, and the y-axis shows how precise that result was. Since the dots are spread very evenly around the center, the authors interpret this as low publication bias and fairly consistent findings across each study. Overall, this suggests that the results of the meta-analysis are reasonably reliable. Here, Table 4 summarizes the key findings from the studies included in the meta-analysis. Instead of giving all of the study details again, this table simplifies the results by showing the main findings from each study, whether that is statistically significance or practical implications that these results might be in. Overall, this table shows that many of the studies support ginger as a helpful treatment for nausea. Some studies found that ginger significantly improves nausea and vomiting symptoms, while others found that it worked about as well as standard treatments like vitamin B6 or drugs like dimethylhydronate. The implication column here is helpful because it explains why the findings matter in clinical settings. For example, it suggests that ginger might be a safe alternative for standard medication, and it may also cause fewer side effects and be more convenient for patients when given in different forms. So overall, Table 4 supports the idea that ginger may be a useful, practical, and accessible option for medication. Here in figure 4, it shows a forest plot for a meta-analysis, and it shows the overall effect of ginger across these included studies. Each line represents one study and shows whenever the results lean more towards the ginger of helping or controlled treatments helping. The most important part of this is the bottom where it has a figure of a diamond, which represents the combination result of all the studies together. When the totals were added up, 48 out of the 99 participants in the control group experienced nausea or vomiting outcomes. This compared to 31 out of the 99 participants in the ginger group experienced those same outcomes. Since fewer people in the ginger group had the symptoms, the overall results suggest that ginger was more helpful than the control. The pooled odd ratios was 0.41, meaning that the ginger group had lower odds of symptoms than the control group. The confidence interval was 0.22 to 0.79 and did not cross 1, showing statistical significance. The p-value here was 0.008, and the I-square value was 0%, indicating studies were very consistent. Overall, this forest plot suggests that ginger may help reduce pregnancy-related nausea and vomiting symptoms. So here in the discussion, this paper suggests that ginger may be a helpful option for pregnancy-related nausea and vomiting. These findings are clinically important because many pregnant patients are hesitant to take medication during pregnancy, especially if they are worried about the safety of a baby. In that context, ginger is appealing because it may be offered as a safer, non-pharmacologic alternative. It also is widely available, relatively inexpensive, and generally well tolerated. These findings should still be interpreted with caution, though, because the studies use different doses and forms of ginger, so the effects may be varied or around for all patients. Another limitation is since hyperemesis gravidarum is more severe than ordinary morning sickness, ginger would probably be better viewed as a supportive treatment rather than a full replacement for standard medical care. Overall, this paper supports ginger as a promising, safe, and accessible support option for pregnancy-related nausea and vomiting, but more research is still needed to determine the best dose and the best form. Thank you. That was our presentation.
Thank you for your time.